If you are diagnosed with obstructive sleep apnea and your doctor advises CPAP therapy, you might be dreading the decision to start. I want to provide some tips today to promote CPAP usage and adaptation so that you can take full advantage of something that can significantly and positively impact your quality of life and your health in the long term. I am Dr. Jose Ramirez, a pulmonary and critical care and sleep physician. I am a CPAP user myself, and I'm going to share some tips how to choose the right CPAP mask, how to minimize facial discomfort and leak, and what to do about these issues as they arise along your journey with CPAP. I am convinced that CPAP saves lives, and it's an intervention that is, with the proper coaching, the right commitment, the right guidance, with patience and perseverance, something that pays off extremely well. So CPAP was invented, as I mentioned in a recent video, in Australia back in 1982 and has been used in the United States for 40 years. CPAP is an advanced air compressor. It's a device that generates airflow, and that airflow is going to be responsible for keeping the back of the throat open throughout the entire night during your entire sleep cycle. Current devices are very quiet. If you compare the noise that a CPAP device alone its corresponding mask makes, it is usually quantified at around 20 to 30 decibels. That versus loud snoring that can be from 50 to 80 decibels, and that is equivalent sometimes to a busy intersection with traffic or a chainsaw sometimes. That's how bad it can be. When you use CPAP, as I mentioned before, snoring goes away, usually close to 100%. Now, some things are important in order to keep that noise at a low as possible, and to be similar to what we consider white noise, you have to use the right mask, the right seal, and so on. So how to choose the right mask? First question is, are you able to properly breathe through your nose? Your physician should examine you and tell you if you are and you're not. But you can also be part of that decision making. If you occlude your nostril, alternating one side and the other, and sniff with enough strength. If you hear this noise, or this one, which is actually worse, then you know that you have poor nasal flow. That can be because of nasal allergies, polyps, or septal deviation, or just the inside of your nose is structured in a way that is narrow. Then perhaps using a nasal mask is not the best choice. Some of these conditions can be treated and improved to facilitate using a small mask. But if you are a known mouth breather, nasal masks are not the option. Let's say you have good nasal flow. Then you can enjoy using a very small mask like this one with my friend here. These masks are very light, very small surface contact area. They have a small inserts that go a little bit inside the nose, and then the system is sealed. Sealed, but of course there's an exhalation vent. This exhalation vent contributes to some extent to the noise. If this mask is used correctly, you can sleep in any position, on your side, on your back, even facing down to some extent, and the noise that it generates is minimal. One of the disadvantages, some patients might develop a bit of nasal irritation, and then that will be a comfort factor on the long run. This is a mask that the hose connects on the front. Some patients put a little clip. There's a lot of creativity along using CPAP therapy. Let's say you do not want to use this system, pillow system, because it's irritative for your nose. Then you could choose instead something that sits under the nose, still a nasal mask, but it's flat. There's no insert. It just sits under the nose, proper seal, and then in this case, the hose connects up here. There's nothing coming on the front. The CPAP hose is usually 4 feet long, so it gives you plenty of leverage to move and toss around. Many patients are concerned, doctor, I'm tossing and turning all night. I'm gonna tangle, I'm gonna get strangulated with the hose. Usually when you use your CPAP, your sleep is not as restless, and you can put your hose under your pillow, and in many ways, that it should not be an issue with tangling. Another concept for nasal mask, instead of being under the nose or pillow system, is a mask that goes just plain and simple, little triangle around the nose. Around the nose, there's no contact under the nose, and it can seal quite well, and it tends to be quite stable, which is also an issue that if the mask is not set up the right way, then if it moves, there's going to be leak, and that of course that generates increased noise, and that is one of the factors for discomfort. Many patients prefer a mask that goes around the nose like a little triangle, and you have to practice and find the right way, the right setting, the right degree of tightening of the straps. So not too tight, not too loose, so that you're comfortable enough. If you are a mouth breather, or if you feel like the nose feels restricted for XYZ reason, then it might be better to use a mask that allows you to breathe through the nose and the mouth. These are called full face masks, and there are many versions. This one is one that is quite comfortable. I know it looks a bit bulky, but if you see, it will sit under the nose, and it allows you to breathe through the mouth also. I personally have to wear a full face, meaning a nose and mouth mask, because of what I mentioned. No matter how I try, it is impossible for me to use just a nose mask. And I find this type of mask quite comfortable, and the level of noise is also low. This is one of the versions of the full face mask. Some others look more like a pilot type, which is this one. This one sits as a triangle around the nose and the mouth. I know it looks bulky, but trust me, once you get used to it, it can be quite rewarding. This mask is made of a special foam, so the level of irritation to the face is minimal, and some patients prefer this type of foam. The second thing about CPAP is to keep it clean, and it's quite simple to keep it clean. To clean your CPAP, you detach the humidifier, you rinse it at least twice a week. If you want to clean it every day, you can clean it every day, but I think 2 to 3 times a week is enough. You can put water and a little bit of vinegar and just wash it out, and this is sufficient. Many of these humidifiers are actually dishwasher safe. You can throw them there. Make sure that the filter on the back or on the side of the CPAP machine stays clean. Depending on how much dust is in your house, you might want to replace it every month, every 2 months. Some of these filters are washable, so you have to figure out which type of filter you have. It is important that you get familiarized with the parts on your CPAP. On your CPAP therapy, which device you use, what are your settings. Another important thing is be familiar with the comfort settings of your CPAP. Most CPAPs will have features that allow the pressure as you exhale to go down, and that's called expiratory pressure release or C-flex, and that is essentially a feature to promote exhalation to make it more comfortable as you breathe in and out. Now it's important, you might want to adjust those settings. Maybe that is a setting that is not right for you. You don't need it or you don't like it. This is a setting that is easy for you to adjust on your own. You should ask your physician to teach you and show you, or the technician that delivers the CPAP machine to teach you how to adjust those settings. Most modern CPAP devices also have the ability to record how much you use them, and it also tries to read or gives you feedback regarding how much your sleep apnea has improved. There are some programs that can be used that are available, some of them for free, but your physician should be able to read and review this data and give you objective feedback regarding how much your sleep apnea has improved, particularly if your sleep apnea was diagnosed at home and not in a sleep center, which most patients can be diagnosed at home, and then you're using an automatic CPAP device. It's not that we leave the effectiveness to chance. We read the data and we make sure that you're receiving the best possible therapy. Your effort, your time is worth it. CPAP devices will continue to evolve. There are these days very small travel devices that you can use if you're a frequent traveler. They are relatively inexpensive. At the end of the day, like everything in life, to have the right mindset and the right attitude is the first step for success with CPAP therapy. Do not be that person saying, oh, I'm not gonna sleep with that. Oh, that is not sexy. Snoring is not sexy either. Indeed, I think CPAP is way sexier than snoring, choking, kicking, and gasping all night, if you ask me. And that goes for the ladies too. Patience and perseverance, one step at a time. If you put effort, if you understand how important this is, if you understand that you are investment into your health in the short, medium, and long term, if you can improve the way you feel during the day, your alertness, perhaps you can save yourself from an accident, from drowsy driving. If you put all these things into perspective, most patients should be able to adjust to CPAP for the long run. I'm not saying that is easy. Everybody will go through an adaptation process, and unfortunately, some patients, regardless of wanting to use CPAP, reading about it, learning, being coached, perhaps CPAP is not for them, and we have some other treatments for those patients. Just be open to their CPAP. CPAP saves lives. If you like this video, subscribe and share. Thank you.